Supreme audit institutions have one of the toughest jobs in government, ensuring that powerful politicians, public officials, and institutions are held to account. Auditors are essential workers in the fight for accountability. Auditors monitor government spending, flag irregularities, and suggest ways to maximize value for money. Essential services people rely on, from clean water to healthcare, often remain underfunded or worse. Public resources to improve these services are underspent, wasted, or squandered. An all-hands-on-deck approach can help ensure that public budgets are spent towards public interests. That means auditors, governments, legislators, the media, and the public must work together for accountability. Auditors play a pivotal role in ensuring budgets are spent as promised, including on sectors that are critical to making progress on sustainable development. Civil society can be a critical partner for auditors. They can leverage community information to add to audit reports, support the independence of auditors, and call for governments to follow through on audit findings. We have seen the power of civil society and auditors working together. In Argentina, auditors worked with patient groups to ensure that the government prioritizes funds targeted to support people living with Chagas. In Sierra Leone, civic groups focused their efforts on cleaner and safer schools. They teamed up with auditors to make sure funds for schools are spent effectively. National auditors can also play a critical role in reporting shifts in spending that siphon resources from critical community facilities, like health clinics. Budget credibility refers to the extent to which a government's actual spending deviates from the approved budget. Auditors can include budget credibility in their work. A UN DESA and International Budget Partnership survey found that most supreme audit institutions have the mandate to decide the scope of their audits. Ghana's National Audit Office flagged that some government offices spent on goods and services resources that had not been appropriated. This supplemental spending left the government at risk of overruns. In Uganda, an audit of the health sector revealed that the Ministry of Health made unrealistic plans and targets. As a result, audited facilities were not able to absorb 21% of funding earmarked. This led to delays in the procurement of medical equipment and construction projects to improve regional hospitals. In Indonesia, the National Audit Office found that some government assistance programs were not implemented in a timely manner, in the right amount, and to the eligible beneficiaries due to unreliable data systems. These findings have a real impact in the lives of people. The International Budget Partnership, IBP, and the United Nations Department of Economic and Social Affairs, UN DESA, help make these connections happen. With a group of supreme audit institutions from different regions, we are developing a handbook on how auditors can take up budget credibility in their work so that budgets deliver for people. To learn more about how supreme audit institutions can assess and address budget credibility gaps and forge valuable partnerships, visit linktr.ee/internationalbudget.